Welcome to another presentation by My Weight World. The topic of this conversation is Overview of the Gastric Bypass Surgery. This presentation is designed to give you a brief overview on the topic of gastric bypass surgery. Candidates for weight loss surgery. In general, the typical candidate has failed multiple attempts at dieting. They are morbidly obese, which means they have an BMI of greater than 35 with 1 to 2 strong medical problems, comorbidities, such as high blood pressure or diabetes or serious back problems, or a BMI of greater than 40. Surgery versus medical therapy. Medical therapy for morbid obesity does not work for most people long-term. Long-term is your entire life. So despite good intentions with diet, exercise, and/or medications, medical therapy usually fails. For these people, surgery is an option. History of weight loss surgery. Weight loss surgery has been around for more than 50 years. The first weight loss operation was in 1954. It was called intestinal bypass. It is no longer being performed. From 1954 to the present, there has been significant advancement in weight loss surgeries. There are a number of good operations to choose from. There are many different types of weight loss surgery. Here is a list of probably the top 5 used today throughout the world. Vertical banded gastroplasty, gastric banding, biliopancreatic diversion with duodenal switch, intragastric balloon, gastric bypass. Gastric bypass is the topic that we will be discussing during the presentation. Let's discuss the normal anatomy of the stomach and intestine. Food goes into your mouth and down the esophagus, which is your eating tube. The food then goes into your stomach, where it is grinded up into smaller particles. No calories are absorbed in the stomach. The small food particles then travel down to the small intestine, which is approximately 20 feet long, and here is where the food is converted into calories and absorbed. From there, the remainder of the particles travel down to the large intestine, where most of the liquids are absorbed, which causes a solid stool. No calorie absorption is performed here. This graphic displays what the gastric bypass looks like. There are 2 main parts of the gastric bypass procedure. First, a small pouch is created for the stomach. Second, about 1/3 of the intestine is rerouted, or rewired, in other words, bypassed. Now that you have seen the graphic on what the gastric bypass looks like, let's see the animation. The stomach is cut in half near the top of the stomach. The small intestine is then rerouted, and a portion is brought up to the little stomach pouch. This creates a bypass. If you look at the intestine, it looks like a Y. This is where the bypass term Roux-en-Y came from. This animation shows you the flow. The flow goes from the esophagus into the small pouch, and then into the intestine, bypassing the major part of the stomach. Look at this diagram. Food particles that come down through the mouth into the esophagus into the first part of the intestine are represented by the yellow arrows. The chemicals that help absorb the food are represented by the red arrows. Not until the red and yellow mix do you absorb calories, which is represented by the green arrows. So, by performing an intestinal bypass, you have taken an intestine that is normally 20 feet long, and normally all 20 feet of intestine absorb calories. The bypass renders 6.5 feet of the intestine unable to absorb calories. Because this part of the intestine represented by yellow arrows has no chemicals for food breakdown, it is just a hollow tube. The intestinal bypass is elegant because there has been no intestine removed, but by shifting the intestine around, there is now a portion of the intestine that can no longer absorb calories. In summary, the gastric bypass works for 2 reasons. 1, you have a smaller stomach, and 2, part of the intestine cannot absorb the food that gets through. Predicted weight loss of the gastric bypass. First, we must determine excess weight, which is existing weight minus your ideal body weight for your height and sex. Example, a 5-foot 4-inch female with a present body weight of 335 pounds. The ideal body weight for a 5-foot 4-inch female is 135 pounds. The excess weight is the difference, which is 200 pounds. The predicted average weight loss after a gastric bypass procedure is between 50 to 65%. So, the predicted weight loss for this woman is 130 pounds. This graph gives you a rough idea of the typical weight loss patterns of a gastric bypass. The gastric bypass is represented by the purple arrow, and for comparison the lap band is represented by the green arrow. The typical weight loss pattern for the gastric bypass is a lot of weight loss in the first and some in the second year, and then typically the weight loss tapers off. Some people actually see some weight gain in the years 3, 4, and 5, depending on their diet and exercise routine. The typical overall weight loss ranges between 50% and 65%. Check with your doctor for further details. Mortality rate. Average program mortality rate, or chance of dying, is 1 in 200. This is a typical quoted rate for a gastric bypass program. Results will vary from one surgeon or program to another. Complication rate ranges between 3 and 15%. This includes major and minor complications. Some examples of major complications are blood clot to the lung, leak, intestine is hooked up to the stomach, or intestine is hooked up to the intestine could cause peritonitis, intestinal blockage. Some examples of minor complications are urinary infection, pneumonia, or incision infection. Please ask your physician about their complication rate. Open versus laparoscopic surgery. The gastric bypass surgery can be performed both open with an incision or laparoscopic. Please see the presentation on myweightworld.com titled Laparoscopic versus Open Surgery for more details. Summary. Modern gastric bypass can have a great outcome. Weight loss is for two reasons. There is a small stomach and a piece of bypassed intestine, which decreases the amount of calories you can absorb. Average loss of excess weight is 50 to 65%. Average death rate is 1 in 200. Average complication rate is 3 to 15%. The gastric bypass can be performed open with an incision versus laparoscopic. This has been another presentation by My Weight World.